This is how to complete your notes on your phone. Click on My Visit, click Clock In, answer the series of COVID-related questions, and verify the client. Then click Clock In at the bottom. Click Vital Signs and begin to document your vital signs. Document the temperature location. Click to document pulse. Document pulse option and the rate. Click Add. Document respiration rate, oxygen level saturation, and click Save. After each section is documented, it will turn green as shown. For the locked segments or the ones that are already pre-documented, just go through those sections and click Save. Next, click the pain assessment. Document if your patient is experiencing any pain, and if they are experiencing pain, please document the pain details. Then click Save once you're finished. After completing the pain assessment, click on the skin condition. Click Skin Condition and document if it's normal, intact, clean. Then click Add. Document the skin temperature and skin color. And click Save. Then move on to the respiratory. Document the lung sounds, if there's any coughing or secretions. If your patient is on oxygen, document the amount of oxygen. If your patient is having secretions, make sure to describe those secretions. At the bottom, click Respiratory Support. Here you will document the trach site and trach type and size, which is already pre-documented. Once you are done, click Save and move on to endocrine. Document if the patient is diabetic. The cardiovascular system. Here you will document the color, skin temperature, if the patient is having any edema. Please make sure that you are documenting every field that is required. There are little red stars next to each section that is mandatory to be documented. Next is GI. Go ahead and document your GI assessment and then click Save once you are finished. Document the last bowel movement, feeding tube site, and make sure the correct G-tube or feeding tube site is documented correctly. After completing the neuro assessment, move on to document the musculoskeletal assessment. There is a beginning of shift checklist that should be completed at the beginning of your shift. This is located last on your notes. Document the time in which you completed the check-off, which it should be at the beginning of your shift, and then go through the checklist and click save. And make sure to document who you received the report from before clicking save. Now we are going to move on to document our interventions. Click the top 3 lines on the left-hand corner and click interventions. You can see your scheduled interventions that are broken down by scheduled times. So our vital signs will be here. They're every 4 hours. Make sure to fully document your set of vitals. It will let you know if your vitals are out of range. You will get a pop-up message like the one that just popped up. Click submit when you are done. To document medication, make sure to click on the correct intervention and the time when it's due. You can adjust the time if needed. And click submit once you're done. Since this medication is a controlled substance, we must complete a NARC log count here. So we'll document the amount that we received before administering. Will appear here as well. It'll ask if you followed the MD order. Click yes. Make sure you have the correct time documented. And then click submit once you're finished. If you document the incorrect amount of medication administered and you click submit, you will get an error message. If you need to document any PRN interventions, make sure you click PRN and click on the intervention. Under the PRN tab, you can see all the PRN interventions and medications. You can document input or output under this PRN section. Here you can see the input and output. You can see all of your completed interventions. Once you are all done, go ahead and click Sign and Submit. Click the acknowledgements. Make sure the parent prints their name and signs below before clicking Submit. Now click the acknowledgement once again and collect your signature. Make sure to document who you left care to, who you gave report to, and click Submit Visit. You will receive an error message like the one shown if you are missing any documentation that needs to be documented.